So is anyone in here interested in a career as a medical professional? Okay, a couple of you. Everyone knows about the professional suffix MD, of course. That's a doctor. That's the one you go see when you hurt yourself. But have you heard of a DO? The chances are many of you have not. I myself am not personally planning on studying medicine, but I have somewhat of an interest because I like to stay healthy. A few months ago I had to see a doctor because I had a pretty bad cut on my finger here. I had to get it stitched up. And the doctor that put the stitches in for me, he had a real interesting name. I had a conversation with him about where he's from. He told me he's from Israel, and I can remember that pretty clearly because I said, like Gene Simmons? And he said, what do you mean? Gene Simmons isn't from Israel. I said, yeah, he is. And so I taught him something new. And I noticed on his name tag it said D.O. And I said, that's strange. What does that mean? Well, I didn't say it to him. I don't want to break his focus. But I went home and I researched it, and I found out in the United States there are two kinds of doctors. So today I'll cover the different types of professional medical titles, such as what MD means, what a DO is, and what might be the right choice for a hopeful medical student, like those of you who are interested in studying medicine. If you all learn one thing today, I'll feel accomplished with myself. So to begin, what does MD stand for? An MD is a doctor of allopathic medicine. But what does allopathic mean? Allopathic is a range of study that aims to combat disease through drugs or surgery. It emphasizes using different remedies, as I just mentioned. It's also known as biomedicine. It comes from Greek roots I found on dictionary.com. Allos, meaning opposite, and pathos, meaning suffering. It is honored in every part of the world, the MD distinction. Although there are a few countries that don't fully honor a DO degree. They only allow manipulation, not full practice rights. There's also some history behind the MD. It was created around the start of our country that we're living in today. In the beginning, it only took 3 years. They had 2 6-month lecture periods, 3-month dissection lab, and 1 year of what they called hospital attendance, which would evolve into what we know as residency today, which lasts 3 or more years. Now, okay, so in the beginning it didn't take as long as it does now, but slowly it evolved into what doctors now study, which is very difficult, as many of you know. So yeah, there were different stages before we reached the modern practice of medicine. But wait a minute, you still know what a DO is. So what does DO stand for? A DO is a doctor of osteopathic medicine. But you're probably thinking, Alex, you just define something I don't know with another word I don't know. Not to insult your intelligence. I'm here to teach you. So what is osteopathic medicine? Osteopathic medicine is a philosophy of viewing the patient as a whole to diagnose, rather than viewing the systems individually. They attend a different med school than MD students do, although it's very similar. They emphasize the prevention of disease. They'd rather they didn't have to see you at all. They'd rather they would be out of a job than for you to pay them lots of money to treat you. And they're much less common than MDs. That's why many of you have not heard of a DO. There are around 50,000 practicing in the United States today. And compare that to about 750,000 MDs. They also have a specific training they go through to diagnose their patients, which they call osteopathic manipulative treatment, or OMT. This is considered the hands-on approach to medicine. It could be that students think DO training It's more difficult, so they avoid it. That's one reason why they're less common. But maybe now you're beginning to understand why in this country, hint capitalism, that DOs aren't as prevalent, based on what I just said. So which specific study would be right for a hopeful medical student? In the competitive field, most students would be happy to get accepted to either program. It's been rumored that DO programs are less competitive than MD programs, which is not true at all. DO programs actually have lower acceptance rates. There are roughly 3 MD programs for every DO program in the United States. Actually more than that, around 3.5. But which one earns more? Because of course many people that go for doctors, they're worried about the money. Not all of them, but. So in the same position and same level of experience, they earn the same. You can't really say there's a difference there. But typically, DOs are known to go into private practice or family medicine, so you don't see them as much in hospitals, although they do attend residency in a hospital. Which one is more cost effective, or which one is going to cost less to go through medical school? Well, it doesn't have to, the cost of medical school for either training doesn't have to do with whether it's MD or DO. It really has to do with if you go to a school that's public or private. And the case is here that many osteopathic schools are private, so they can cost more. So those were a couple of points, although not very significant to consider if you're thinking about going into the field. So of course there are more spots in MD schools. So of course mathematically, if there are more schools, more students can go to MD schools. So that's another reason why there's more. So to review one last time, there are 2 kinds of doctors in the United States, one of which is less common and doesn't really have any benefit over the other, unless you want to be hip and different, I guess. So for those of you in here that want to study medicine and choose MD, I don't blame you. Thank you.